the Wellness Wizards channel. Today we are going to talk about breathing. Breathing is important to health and wellness and for all the cells of the body to make energy and is one of the 4 vital signs of life. If breathing becomes difficult and stops after 4 minutes, your brain cells would shut down and the body will die within 5 to 10 minutes. Breathing occurs through the nose or the mouth when air is inhaled and passes to the lungs, where oxygen uptake happens through diffusion in the alveoli. These are tiny air sacs within the lungs. And air is exhaled with the waste products of carbon dioxide and other toxins from the lung and via the bronchial tubes, the trachea, the pharynx, and through the nose or the mouth. This repetitive process is called respiration and starts at birth and stops at death. The number of respiratory cycles per minute is the respiratory rate and is an average of 2 seconds for inhalation and 3 seconds for exhalation, giving rise to 12 to 16 breaths per minute. The respiration rate can be altered by weather, exercise, illness, and within the different age groups. The depth and rate of breathing is automatic and unconscious and is controlled by homeostatic mechanisms which keep the partial pressures of carbon dioxide and oxygen in the arterial blood constant. This keeps control of the pH of the extracellular fluids. Hyperventilation or overbreathing or underbreathing or hypoventilation decrease and increase this partial pressure respectively, and this causes a rise and fall in the pH respectively and can cause distressing symptoms for the individual. Breathing also has other important functions such as providing the mechanism for speech, laughter, and other expressions of emotions. It is also used for reflexes such as yawning, coughing, and sneezing. There are 4 different modes of breathing, and each requires a slightly different process to allow inspiration and expiration. These are Hyperpnea, which is a quiet, normal breathing that requires contraction of the diaphragm and the external intercostal muscles. This breathing occurs at rest and does not need cognitive thought of the individual. Diaphragmatic breathing. This requires contraction of the diaphragm muscle and is called deep breathing. Costal breathing. This requires contraction of the intercostal muscles and is called shallow breathing. Hyperpnea is a forced breathing and requires muscle contractions during both inspiration and expiration, such as contraction of the diaphragm, intercostal muscles, and the accessory muscles. This breathing occurs during exercise or on active manipulation of breathing, as in singing. During forced inspiration, muscles of the neck, including the scalenes, contract and lift the thoracic wall, thereby increasing lung volume. During forced expiration, accessory muscles of the abdomen, including the obliques, contract, forcing the abdominal organs upward against the diaphragm. This helps to push more air out of the lungs as the diaphragm rises into the thorax. The internal intercostal muscles help to compress the rib cage, which further reduces the volume of the thoracic cavity and thus expelling even more air. There are other types of breathing that are associated with illnesses. These are hyperventilation. This is when you breathe faster than your body needs to and you get rid of too much carbon dioxide, and maybe due to exercise, anxiety, or asthma. It makes you feel dizzy or confused. Dyspnea. This is shortness of breath, like you can't get enough air. It is a sign of many heart or lung problems, obesity, poor health, or if you're at high altitudes, but also can be a sign of serious impending heart attack or asthmatic attack if it comes on suddenly. There are many other types of dyspnea, and they occur in certain positions related to certain medical conditions. For example, orthopnea occurs on lying down. This usually happens when blood builds up in the lungs, as in heart failure, or as in paroxysmal nocturnal breathing dyspnea that wakes you in the middle of the night, and this may also be due to heart failure. Tropopnea is dyspnea when you lie on one or the other side, and platypnea is a rare shortness of breath when you are standing up. Slower breathing is called bradypnea. Labored or difficult breathing is called dyspnea, and cessation of breathing for any cause is called apnea. These can all occur in medical conditions that are associated with the respiratory system. Some of the main medical conditions that affect the respiratory system are asthma, COPD or chronic obstructive pulmonary disease, interstitial lung disease, cystic fibrosis, bronchiectasis, chronic pneumonia, pulmonary hypertension, and lung cancer. In 2017, the Lancet journal cited that close to 545 million people worldwide had a chronic respiratory disease, and close to 4 million died from this. Wheezing refers to a high-pitched whistling sound that happens when you breathe in or out. It is caused by tightening of your airways. Your airways can tighten due to allergies, infections, certain medications, asthma, gastropharyngeal reflux disease, chronic obstructive pulmonary disease, anything that causes swelling or inflammation in your airways. It is healthier to breathe through your nose as it warms or cools the air to the right temperature for the lungs. It adds moisture to the lungs and bronchial tubes and has tiny hairs that act as filter and trap any toxins, pollen, dust, or insects. The nose also adds resistance to the inhaled breath, which increases oxygen uptake and strengthens the lung elasticity. However, over 50% of the population breathe with their mouths, especially in the early morning. Mouth breathing causes a lot of complications to your wellness. It is often difficult to know if you are mouth breathing, especially if you do it when you are sleeping. To know if you are mouth breathing, you should check for certain signs and symptoms, such as you wake with a dry mouth, you are hoarse when you get up from sleep, you are told that you snore a lot, you have bad breath, you wake up feeling tired and irritable, you wake up with a headache, you have brain fog, you have dark circles under your eyes, you have postural changes, you suffer with gingivitis, inflammation of the gums, your lips don't seal when you close your mouth, you have an open bite or a high narrow palate, which you were told by your dentist or orthodontist. Treatment to stop mouth breathing include using nasal decongestants, saline mists, antihistamine and allergy medications, steroid nasal sprays, nasal dilators or adhesive strips applied to the bridge of the nose, CPAP machines, which is continuous pressure, positive pressure airway pressure, or for more intense cases, surgical removal of swollen tonsils, adenoids, nasal polyps, cysts, etc. Keeping the house clean and allergen free is very important, and conscious breathing with the nose throughout the day is very important also. Using air filters, using a large pillow to prop your head up at night, reduce the stress around you. If you do exercises, that will help you also, and taping of your lips. There are lots of tips for better breathing and strengthening of your lung, and these are doing diaphragmatic breathing, doing simple deep breathing, counting your breaths help you to increase the length and holes between your breaths. Staying hydrated helps keeping your airways moist. Laughing, joining a breathing club, pulmonary rehabilitation. Look at your sleeping position, as this can affect your breathing. Keep your spine aligned, as this helps to keep your airways open and prevent snoring. Look at your lifestyle and change wherever possible. For example, if you are overweight, lose weight. Eat nutritious foods with lots of antioxidants. Avoid environments where you can inhale secondhand smoke and other irritants, for example, artificial fragrances, molds, and dust. Use air filters indoors. Practice meditation by just focusing on your breath and consciously trying to control it. Look at your posture good posture keeps your chest and thorax expanded, allowing for good movement of your chest, and so enhance your respiration in activities of daily living. Consider taking up singing as it improves your breathing and lung function. It reduces shortness of breath. It teaches people with lung conditions to breathe more slowly and deeply and strengthen the breathing muscles like the diaphragm and the voice. Get more flexible by doing stretching exercises for shoulders, chest, and back. This will help you to expand your ribcage in all directions. Get more exercise and activities such as swimming and rowing that expand the chest and lungs. In my next video, we will look at the different breathing techniques. Stay safe, stay well, and don't forget to like and subscribe.